Hello, I am Dr. T.S. Roy, ex-professor and head, Department of Anatomy, All India Institute of Medical Sciences, New Delhi. Today, we will be discussing about the pectoral region. The specific learning objectives. At the end of the session, a student should be able to identify the bony prominences of the pectoral region and should know how to count the ribs. A student should know the dermatome of the front of the chest wall. A student should be able to describe the attachments, nerve supply and actions of the pectoralis major and minor muscles. The student should describe the clavipectoral fascia, its applied anatomy and enumerate the structures piercing it. Dermatome. What is dermatome? Dermatome is the part of the skin supplied by a specific segment of the spinal cord. Here you can see the dermatome of the upper part of the chest and the lower part of the chest is different. The upper part dermatome is by cervical nerves and the lower part dermatomes are thoracic nerves. The dermatome of the upper part is from the cervical segment of the spinal cord and dermatome of the lower part is from the thoracic segment of the spinal cord, and there is overlapping between the dermatome of the cervical and the thoracic region. The upper part of the chest wall is supplied by the supraclavicular nerves whose dermatome is C3, C4. Dermatome of the tip of the shoulder is C4, as because there is no cutaneous branch of the first thoracic nerve, there is overlapping between the cervical dermatome and the thoracic 2 dermatome at the sternal angle. Here you can see the dermatome of the lateral part of the chest wall. Surface anatomy. Surface anatomy is very important for clinical and surgical maneuvers. So, you should be able to identify the following. The jugular notch. The jugular notch is a depression between the medial ends of the two clavicle. Palpate the jugular notch at the base of the neck, then your finger should come downwards. You will be able to palpate a ridge in the anterior surface of the sternum, that is the sternal angle. This is very important for counting the ribs, because the second rib articulates with the sternum at sternal angle, and from second rib onwards you can come down the other ribs. The first rib is covered by the pectoralis major muscle and it is not palpable. The clavicle is a subcutaneous bone and you can palpate the whole clavicle. Come to the lateral end of the clavicle at the tip of the shoulder, one can palpate the acromion process. Just below the lateral part of the clavicle is the infraclavicular fossa. At the junction between the medial 2/3 and the lateral 1/3, you come below or 2 to 3 centimeter below the clavicle, you can palpate one bony prominence, that is the coracoid process of the scapula. Medial to the infraclavicular fossa is the pectoralis major muscle, and in muscular person one can identify a groove between the clavicular origin and the sternocostal origin. Lateral to the groove or infraclavicular fossa is the deltoid muscle. Here it is the deltoid muscle, and medial to the deltoid, upper part of the pectoralis major and the clavicle, one depression is visible, that is the deltopectoral triangle. Superficial fascia. Deep to the skin lies the superficial fascia. The superficial fascia contain fat, some connective tissue, cutaneous blood vessels, nerves and lymphatics. The mammary gland lies in the superficial fascia. The axillary tail is very important surgically. It goes towards the axilla. The superficial fascia is continuous throughout the body, and distribution of fat in the superficial fascia varies from person to person. The rounded contour of the body is due to superficial fascia, and it is a secondary sexual character in females. Superficial fascia and mammary gland. We will cover the mammary gland in a separate video, but here there is minor description of the mammary gland. The mammary gland is made up of gland, fatty superficial fascia and overlying skin with the nipple and areola. In male, the mammary gland is rudimentary. The position of the nipple is variable. It lies just medial to the mid-clavicular line in the fourth intercostal space. The mammary gland lies over the pectoralis major and serratus anterior muscle. The mammary gland is supplied by the branches of the axillary vessels and internal thoracic vessels. Deep to the superficial fascia is the deep fascia. The deep fascia in the pectoral region covers the pectoralis major and it is continuous with the periosteum of the clavicle and the deltopectoral groove. Beyond that, it is continuous with the fascia covering the deltoid muscle. The axillary fascia stretches between the pectoralis major and the latissimus dorsi muscle, that is a part of the deep fascia also, and it forms the base of the axilla. The pectoralis major and minor muscle. These are the two major muscles in the pectoral region. The pectoralis major is a fan-shaped muscle taking origin from the anterior portion of the chest wall and inserted into the upper part of the humerus. The detail of the origin, it takes origin from the medial half of the anterior surface of the clavicle, the anterior surface of the lateral part of the manubrium sterni, the lateral part of the sternum, upper 7 costal cartilages and aponeurosis of the external oblique muscle. The clavicular fiber comes downwards and laterally to be inserted into the lateral lip of the intertubercular sulcus of the humerus. The sternocostal abdominal fibers goes upwards and makes U-shaped tendon, then it goes deep to the clavicular head to be inserted into the upper part of the intertubercular sulcus in the humerus. The action of the pectoralis major is very important. It is a flexor of the shoulder joint. It is also adductor of the shoulder joint, and when you show the action of the shoulder joint, you fix your elbow with the body and make your arm in supine position, so that when you show the adduction, the shoulder is in contact with the body wall, and medial rotation when you are showing, you rotate your palm towards medial side. When you are showing the lateral rotation, show it to the lateral side. Fix the elbow with the body, there is no pronation and supination, you can show the movement like this. So, your humerus is rotated either medially or laterally. The action of the pectoralis major is, it is the major flexor, adductor and medial rotator of the arm. Nerve supply. The pectoralis major muscle is supplied by medial and lateral pectoral nerves. Pectoralis minor. Deep to the pectoralis major is the pectoralis minor muscle. It is a small triangular muscle which takes origin from the anterior surface of the third, fourth and fifth rib. It takes origin from the upper margin also of these ribs and also the fascia covering the intercostal muscles in between these ribs. It is inserted onto the upper aspect of the coracoid process which extends up to the coracoclavicular ligament. What is the action of the pectoralis minor muscle? The pectoralis minor, it protracts the scapula by pulling it anteriorly. What is the nerve supply? The pectoralis minor is supplied by the medial and lateral pectoral nerves. In short, the muscles of the pectoral region are pectoralis major, which takes origin from the medial half of the clavicle and the manubrium sterni, the body of the sternum, upper 7 or 8 costal cartilages goes upwards and laterally to be inserted into the lateral lip of the intertubercular sulcus of the humerus. It is supplied by both medial and lateral pectoral nerves and it is a flexor, medial rotator and adductor of the shoulder joint or adductor of the arm. The pectoralis minor, it is a small muscle deep to the pectoralis major, takes origin from the anterior surface of the third, fourth and fifth rib, including the fascia covering the intercostal muscles goes upwards and laterally to be inserted into the upper surface of the coracoid process. It is supplied by both medial and lateral pectoral nerve, and it is a protractor muscle, depresses the scapula. The subclavius muscle, it is below the clavicle. It takes origin from the upper surface of the first rib, including the costal cartilage, and it is inserted in the under surface of the clavicle. It stabilizes the clavicle during the movement of the shoulder joint. It is supplied by nerve to subclavius, which is a branch of the upper trunk of the brachial plexus. Serratus anterior is a muscle of the axilla, but you can see here the origin of the serratus anterior from the lateral surface of the upper 8 ribs is goes upwards and laterally to be inserted into the medial border of the scapula. We will study the serratus anterior during the demonstration of the axilla. The pectoral nerves, there are two pectoral nerves, the lateral pectoral nerve and the medial pectoral nerve. The lateral pectoral nerve pierces the clavipectoral fascia. It comes from the lateral cord of the brachial plexus and it supplies both the pectoral muscles. The medial pectoral nerve is a branch of the medial cord of the brachial plexus. It comes from C8 to T1 and it supplies both the pectoralis muscles. Axillary vessels and pectoralis minor has a very important relation. As you can see, some part of the axillary vessel lies deep to the pectoralis minor muscle. So, it divides the axillary vessels into 3 parts. The part proximal to the upper border of the pectoralis minor is first part, part deep to the or posterior to the pectoralis minor is the second part, and third part is distal to the pectoralis minor muscle. And at this point you should remember the branches of the axillary arteries. First part has one branch, that is the superior thoracic artery. Second part has two branches, the lateral thoracic and acromiothoracic, and the third part has three branches, anterior and posterior circumflex humeral arteries and the subscapular artery. Clavipectoral fascia. The clavipectoral fascia is a part of the deep fascia which lies deep to the pectoralis major muscle. The clavipectoral fascia splits, or this deep fascia splits to enclose the subclavius muscle. The anterior layer is attached to the periosteum of the clavicle and continuous in the neck. The posterior layer is continuous with the deep cervical fascia and fascia covering the omohyoid muscle in the neck. This fascia joins, and at the upper border of the pectoralis minor muscle, it splits again to enclose the pectoralis minor. Then at the lower border, it joins to be continuous with the axillary fascia. Medially, the clavipectoral fascia joins the lateral border of the sternum to be continuous with the periosteum of the sternum. Laterally, it extends towards the shoulder joint and continuous with the coracoclavicular ligament. The clavipectoral fascia is important because certain structures pierces the clavipectoral fascia. The structures piercing the clavipectoral fascia are, already we have mentioned, the cephalic vein. Cephalic vein is very important surgically and medically. The cephalic vein, after piercing the clavipectoral fascia, joins the axillary vein. The other structures piercing the clavipectoral fascia are the thoracoacromial artery and the vein, the medial pectoral nerve, and some lymph vessels. A pus collection deep to the clavipectoral fascia may spread in the neck or in the lower border of the pectoralis major in the axilla. The lymphatics of the axilla will be covered in the next video, but here we can see some of the lymph nodes at the lower border of the pectoralis minor muscle. These are called anterior group of lymph nodes of the axilla. They lie along the lateral thoracic artery. It receives lymphatics from the abdominal wall, from the chest wall, and also from the axillary tail of the mammary gland. So, take home message: surface anatomy of the pectoral region is important for medical and surgical maneuvers. The pectoralis major and minor muscles are important for Shoulder joint. Accumulation of pus deep to the clavipectoral fascia may spread in the axilla and neck. You should study this topic from Gray's Anatomy for Students, 6th edition, the original Gray's Anatomy, 43rd edition, and Grant's Atlas of Anatomy, 12th edition. Thank you.